Hey everyone, thanks for joining me today. We'll be speaking with Dr. Wendy Humphrey Van Meter. She specializes in providing dental care for children and adolescents and works with many special needs kids and parents in the most amazing and comforting way. Not to mention that she's incredibly sweet as a person. If you're enjoying our podcast, please rate and review us wherever you listen to podcasts and share us with a friend. That's how we make our voice stronger. Thanks for listening. Welcome to my Autism Tribe, a community of advocates that are linked by autism but bound by strength. This is a time to find our sounding board and shoulders that help us carry life's load without the fear of criticism. We give and receive. We nurture and empower. I'm your host, Susan Scott. A trip to the dentist is sometimes not the very favorite thing to do for a lot of children and even adults. But to an autistic child, it can be absolutely traumatic. Not only can the visit itself cause distress because it's not part of the normal routine, but there are strangers putting hands in the mouth, strange sounds, tastes, bright lights, and maybe even a little pain. It's not always fun, but there are things that you can do to make the whole experience as painless as possible. Not all dentists are comfortable with children on the autism spectrum, and even some pediatric dentists. There are questions you can ask when deciding if a dentist is the right choice for your family. Today's guest, Dr. Wendy, in full disclosure, is my son's dentist. She's been absolutely amazing to work with, and now I'm happy to report that her office is no longer on Alex's bad list of places to go. Let's welcome Dr. Wendy. Thanks so much for joining us today, Wendy. I'm really excited. I've let everyone kind of know that you are my son's dentist, and I absolutely love you to death. So thanks for joining us.
No problem. Happy to chime in and offer any support that I can for any families and patients out there to try to make dentistry a little bit less unnerving, a little bit more pleasant for all of our patients.
I know that you've made the experience for us just really, really good and comforting. And so I guess we'll kind of start off with your background. So, you're here in Lexington, Kentucky. That's where you're seated. Why don't you kind of share with everyone how you got into dentistry and then pediatric dentistry to be specific?
So I am a hometown girl. I've been in Lexington since I was a toddler, and all of my training was done through the University of Kentucky. So I did my undergraduate training there. I went to dental school at the University of Kentucky, and then I also actually did 2 residencies. I did a residency in hospital-based dentistry for general practice, and then I also did a pediatric dental residency where I was also a part-time faculty member, of which I still am a part-time faculty member at the College of Dentistry for pediatric dentistry. I knew I was interested in healthcare from early age. So when I was in college, I went and volunteered at all different areas of healthcare, from physical therapy to pharmacy to working in a hospital, and kind of pushed dentistry off to the side because my mom is a former faculty member at the College of Dentistry at UK. Mm-hmm. And then finally decided, hey, let me go check that out. And of course, fell in love with it. And there are pretty much two people that I attribute introducing me to pediatric dentistry. That was my mentor, Dr. John Mink, who passed away about 2 years ago at the young age of 93 and practiced dentistry up until his mid-80s. Yeah, he's phenomenal. And one of my best friend's fathers, who I met at college, who is a pediatric dentist down in Nashville, and his son is also a pediatric dentist down in Nashville, Tennessee. So they introduced me to the specialty, and then it's the one I fell in love with. I appreciated the fact that I really enjoyed working with age extremes. I either wanted to work with the really young or I wanted to work with the really old. Mm-hmm. So I chose pediatrics.
Awesome.
And haven't regretted it or looked back since.
Well, you definitely have just the motherly tone, and of course you're a mother yourself, so that certainly helps, although I'm sure that you've always been amazing, like when you've been working with kiddos. But I do think that it's a specific calling that people have to have, because Alex has been to some dentists that I felt like they could have been amazing dentists, really, and even in the pediatric field, but they just didn't have that connection, I felt like, with the kids, and that makes all the difference in the world. It really does. And so, as a mother yourself, when we first kind of called you and got a visit with you, your staff was just, everyone there was just really, really great, very soft-spoken. The waiting room was really nice. Of course, you have like the toys and things like that. And the first visit, now Alex has, of course, made a lot of progress, and that's really due to all of your amazing staff and yourself. But it was more of like a friendly visit. And when people make their appointment with you, what are some of the processes that you use when you're first working with a parent? Let's say they have a little kiddo that's on the spectrum. Do they let you know beforehand? I know that I did. How do you prepare them for that?
Well, some parents are really good about letting us know actually over the phone when they first call to set up that first initial appointment, and whether or not kind of what they're looking for. It really helps. My staff are actually pretty well trained, as long as you're willing to offer that information over the phone, as to try to get some of that information to say, okay, do you want this to be more of a pleasant visit where we come in and just let your child check out the space, let you as a family, as a parent or a caregiver check out the space, and then how, depending on how the child actually responds to our environment, how much more we're willing to go beyond that. If that's not information that's given over the telephone, then it's normally given to us when completing the health history. We ask a lot of questions on our forms when we're having you come in, asking if there's any fears, if they've had any negative experience in the past with loud noises, with clearly with dental things such as dental x-rays and examinations and things like that kind of prompt parents if they're willing to share that experience with that. So that way we can try to help cater the appointment more to the patient. We have some patients that literally after 2 or 3 appointments, as we graduate the experience in, so maybe the first experience is just playing around, getting to know us and our staff. Sometimes it's helpful if I can go ahead and get an examination done at that time, whether or not, if there's a concern that the parent or caregiver has. Other times we'll just hold off and bring them back in. It's not always set at 6 month intervals either. A lot of times we'll offer to bring the patient back in for what we call kind of a desensitization appointment. I'm used to working with occupational therapists, speech pathologists, and then honestly just alternative caregivers that are involved in children's lives, just to try to get past certain oral aversions they have. And it's really the more information that we can give one another is what really helps to make that experience really try to get it just more pleasant for everyone. Sometimes that can happen within 2 to 3 appointments, and within a year of when they first come to our practice. Other times it takes years. So when it does take a lot longer, it's not only exciting for myself, but it's really exciting for my staff members. And we get really proud when we see a patient who used to be able to stand in the corner to let us do the exam,
Sure.
and maybe introduce a toothbrush, to, if it takes 3, 4, 5 years down the road to get them to sit in the dental chair and be able to do the full experience, to be able to do the prophylaxis and use hand instruments, as well as being able to do that, what we lovingly call our little tickle brush or spin brush.
Yeah.
But that also takes help from home, is saying, will they tolerate a battery-powered toothbrush in the mouth at home, and trying to put things in terms. And then every time they come in, if once they get used to one thing, introducing something new towards the end of the appointment, so that way we can reintroduce that at the next appointment. But the biggest thing is what are their aversions? Are there certain things that send them off? Like, do they do not like touch? Do they avoid it? Do they seek deep touch? Because in a dental office, especially a pediatric office, we're going to stimulate every single sense you have.
Oh, sure.
Sight, yep, across the board.
Absolutely.
So just getting to know kids and knowing that sometimes that if there is a concern, that sometimes we may have to struggle a little bit just for me to get in there and do a look, but do a quick look just so I can say, yes, this is an issue, or no, this isn't. And then also to say, hey, what can we be doing at home, as well as when they come to the office, to try to keep things healthy.
Yeah. There is, I mean, it's a whole sensory experience. And I really worked with Alex on creating, what we call social stories on going to the dentist. And there are tons of kids' books out there about going to the dentist, the Berenstain Bears, and like a, episode on Mr. Rogers. But I think that that's really important. But I even, you can get at, any of the grocery stores or pharmacies or whatever, the little packs, I don't even know, I'm going to slaughter this language, but the little dental instruments,
Yeah,
and
you can. And
yeah.
most recently at Target, and I think it's just now online, but they had it at the dollar spot for a while. They had a mirror and an Explorer, and an Explorer is just what everybody knows is the metal hook that is the tooth counter, that just helps us check for decay. And then little plastic teeth, that there's Play-Doh teeth. I mean, there's all different ways. And the other thing that I love, and that I think that pediatric dentists specifically are really good about, is that online we have tours of our office. So they're not necessarily virtual tours. For my office, it's just a photographic tour, but it has pictures of the waiting room and the front check-in desk, and some of the toys and things that they can explore, what our dental chairs look like, what just the reward system, so that way at least the environment is exposed to it. And we've helped therapists, I know, create those visual stories before by helping to put together a book. And some parents will go as far as to ask for photographs of the staff members, and those are also online, but specifically asking for more detailed ones.
That's a really cool idea, is actually going online and you've provided those pictures, because that can be huge for a child. It's all about preparation and talking to them about it, sometimes weeks in advance, and really getting them prepared to go in. And even once you're there, just like you would as if, when you have a baby, you have the little diaper bag of all, it's like an arsenal of anything that you may ever need when you're on the road or in a restaurant or whatever. It's like, I would pack an arsenal. So it's like, I would have the iPad, of course I have my phone, sunglasses, earplugs, you've got a lap weight or a heavy toy, all of this stuff that I would bring in if at any second notice I would need it, then I would have it. So you've probably experienced a lot of people bringing in bags of, their tools.
And what most people don't realize is half of the things you just mentioned, we already have here. We have various shades and colors and sizes of sunglasses, because we know that light can be bright. If it's still too bright, we won't even use the dental operatory light until the very last, and we'll tell the patient ahead of time we're going to turn it on and say we need this for 10 seconds, 20 seconds, and maybe count. But it's just, again, knowing all of those different things that may trigger for them to have a negative response, or something they may seek. We have some patients that like bright light, so that will use clear glasses with instead of sunglasses, just to help protect their eyes. We have of course, if we get to the point of taking dental radiographs or x-rays of the teeth, we have the heavy lead aprons that we use as part of our standard of care, but sometimes we use those just as extra weight for the patients. If we know that someone seeks deep sensory input, I will apply firm pressure for a majority of my examination, just on the shoulder or on the upper arm, and not try to remove that pressure while I'm actually doing other things with my other hand in their mouth. We have iPads, little miniature iPads here that we have a little clip with it, so a child, if they want to, can watch or listen to music or watch. We stream really anything that you can find on Netflix, YouTube Kids, anything like that. There's one patient that we have that comes to mind who's been seeing us for a very long time, and she likes to listen to Wheels on the Bus over and over and over again. But it helps her to sing through the appointment, and she loves that song, and that's what we do.
That's awesome. Yeah, so it's really just making it to get through it, because we all have to go to the dentist, whether we like it or not, and just trying to make, it's probably never going to be an absolutely fun experience for most of these kiddos, but if we can make it through, then that's great. As far as like the toothpaste, I know this is kind of a somewhat of a big thing for Alex. He'll tolerate a different toothpaste, but we have a very specific brand of toothpaste that's bubblegum flavor, and that is the toothpaste that he will tolerate the most. Like, do you ever see parents bringing in their own toothpaste, or how
Yes.
do you guys work with that?
Well, we also know that flavors are big, textures are big, and that kind of thing. So we really are fairly accommodating with that, and we'll kind of let the parent help guide us to see which product would be better for them. If there is a certain level of stain on the patient's teeth that we feel like that we can't quite remove with hand instruments, and they will tolerate the Profi-Angle, we may just selectively in certain areas use kind of a gritty textured paste, but then just immediately just wipe it off after we get the stain off with a piece of dampened gauze, like a piece of wet, we call it like a little wet towel or rag to the patient, but
Sure.
It's just a piece of gauze that's wet. In terms of home care, we say use what works. The mechanical act of the toothbrush brushing is what's doing the lion's share of the work.
Okay.
Toothpaste itself is either flavoring to motivate the child to put the toothbrush in their mouth, or it has the products in it like fluoride, which I am a believer in. We do promote the use of fluoridated products in our office, but if that is something that you and your household have decided to not use, then we would encourage you to use a sugar substitute like xylitol products that are also known to help prevent plaque formation on the teeth, which is a nice alternative to fluoride if you don't feel comfortable using fluoride products in your child's mouth. But for us, it's all about what can we get in. If it's water on a toothbrush, great. If that's comfortable, then we say maybe we can slide a fluoride rinse that the toothbrush can be dipped in and then brushed with. So you're delivering fluoride to the mouth, even though the child may not tolerate the fluoride.
Oh,
but again, the goal is to desensitize them and slowly introduce a little bit. But you're right, trying to find the right flavor, the right texture, because even toothpaste that you can buy at Target and Walmart or off of Amazon all have different flavors and different textures on whether or not it's a gel or a paste or combination of it. And then as a parent, I have an 8-year-old and a 5-year-old. What gets really frustrating is you think you're doing really good. They love this flavor, and then you find out that they're going to discontinue that flavor, or the character that they love, that they're motivating with, they're not making on that toothbrush anymore. So that gets to be so frustrating when you're like, yes, we've got this toothpaste, it's great. And then all of a sudden they're like, new and improved. And then you realize it's not quite the same flavor and it's not quite the same texture. And you may realize that to you it tastes the same, but your child will tell you otherwise.
Oh, sure. The slightest difference.
Learning how to adapt. And so that's why with like Alex, the bubblegum's great, because that's a flavor that's not going to go away. But some of the other ones, my son's favorite one is a watermelon burst, and it's a gel delivery one, and I know that they're going to pull it off the market soon, and so it's going to take with him probably trial and error of a couple other flavors to try to see which one he'll like. He likes the gel because it's not as gritty as a paste. And it took a long time of us kind of trying and to find that, because he does have some of those sensory issues that I've had to deal with as a parent. So sad to do that, but I get to face that same situation. But the biggest thing is, like I said, is getting the toothbrush in. If your child has so many oral aversions and has a hard time with toothbrushing, normally there are other oral aversions that are also happening as well, or may not like being touched around the mouth and the cheeks. And that's when it really helps to work with occupational therapists and a speech pathologist about trying to introduce teeth cleansing aids into the mouth that are age appropriate, but also just knowing that it's something that has to be done. because it's a fairly quick thing that can be done that can be so preventative of so many issues down the road. Cavities, possible infection, gum disease, and all of that can be prevented with really good oral hygiene from the start.
That's amazing. And that's been one of my fears with Alex, although, so far, knock on wood, he has not had any cavities or any really dental problems. And that's been with a lot of work. But some of those kiddos, let's say, that do need, like if they have a cavity and they need to get that filled, do you guys do sedation, or what is the process for that?
So here in our office, it all just depends on the volume of treatment, the type of treatment that needs, and then the patient itself. Sometimes it can be done with just adding in a little bit of laughing gas. Sometimes that's not even needed. Sometimes they'll tolerate getting treatment done in the chair. We do offer oral conscious sedation in the office. There are different medications that we can offer to use, again, depending on the child themselves, the type of treatment that needs to be done. And then there are other alternatives beyond oral conscious sedation. Those are not ones that I offer to do currently in my practice, but they are available not only in my area, but then in other areas of the country where there's intranasal sedation, where they can use just like basically it's called a nasal I'm going to mess that word up. It turns a liquid medication into a nasal spray.
Okay.
And sometimes that can be effective. Again, my 5-year-old son does not like having nasal spray used in his nose, so I think for him, if he ever needed a procedure, I think an oral medication would probably be a little easier on him. Some patients require IV sedation, and then other patients can't really tolerate anything, so the safest place for them, especially if it's something that's just really bad or really big, is for outpatient surgery in the operating room. Yeah. But at the same time, I also always encourage parents, if you're going to do that, do they need blood work? Do they need other things done while they're there in that surgical setting that they may not otherwise be able to have done in a traditional setting? And it's not unusual at all for patients to have multiple procedures done at the same time. They may need like an EKG or an echo done of their heart at the same time. So they'll kind of have multiple services that are doing multiple things on a child all in one fell swoop if you're going to that level to provide dental care.
Sure, that's a great point. I never even thought about that.
Yeah.
Well, if a child really starts having some problem behaviors when they're back there, they're in the chair, what are some of the things that parents can do to work with you to prevent those problem behaviors, or as they're occurring, what is the best way that parents can engage the dentist or their child?
The biggest thing for me is communication. If there is something that's happening mid-treatment, and we are a pretty quick team around here too, there are things that we can do to just immediately either temporize or stop what we're doing, and then have discussions with the parents about, okay, what do we think the possible triggers were, so that way to come back in or to try different approaches to things. And then also, as you said, as a parent, you're right. You're like a scout. You're prepared. Be prepared. You always come in with kind of like your bag of tricks and things like that. So it's helpful for us to know that, we have some things in our office that we know have helped patients in the past, but if there are other specific things that we can do, bring those with you, and we're happy to do everything we can to try to be as helpful as we can. But the biggest thing is just communicating, for us to try to introduce things slowly, to, like I said, maybe initially having to kind of battle through getting an exam done if that's necessary, but just really trying to get to know each other. And that's what it takes. And I think that's the biggest battle, is having the patient get to know us in our practice, and then for us to get to know them, and also knowing that those needs change.
Yeah.
And trying to learn to adapt. So communication is before, during, and after is the biggest thing.
Yeah. I want to let parents know as much information as they can provide the dentist or the office staff beforehand, the easier I think it's going to be for everyone involved. And there's nothing wrong with, just sharing as much information as you possibly can, because there's never too much information. I think it's, all of it can be very, very useful. So Thank you so much for your time, Wendy. You've been absolutely wonderful, not only as a dentist, but as a friend. And just, as I told everyone, it's no longer on Alex's bad list of places to go, that he actually looks forward to it.
And that's what we want. That's our overall goal.
Yeah. I mean, I think a lot of it, yeah. I mean, a lot of it, those little gumball kind of machines that have the different toys in there, that's a huge, huge plus. But yeah, absolutely. Everyone there has been amazing. And it's a good fit for Alex. So, that's our dentist home right there.
Well, we love seeing him. He's a pleasure.
Parents and caregivers need to be aware that not all dentists have the experience or comfort level when working with patients on the autism spectrum, and that's completely okay. Just make sure to ask the questions that will provide you with information so you can make the best decision. Some of these questions may include, do you work with special needs kids? Are parents allowed to stay with their children? How do you handle a child's anxiety? What do you do if you encounter problem behavior during the visit? Finding the right dentists that connect with your child will help in creating a positive dental experience. Just because you've had a problem visit to the dentist doesn't mean that this will always be the case. Just keep working at it. Thanks for joining me today and for being a part of my Autism Tribe. I'll see you next week.